And thank you all for joining me today for our telephone town hall on stopping the spread of Omicron variant. Battling this pandemic has been anything but easy. The COVID-19 virus is constantly evolving, and the newest variant, Omicron, is certainly one of the most contagious. Just this past week, Marylanders reported over 89,000 new cases. I know that most of you are feeling lost, confused, anxious, frustrated, and some are even experiencing grief from the loss of a loved one. We want to make your life easier if we can by answering your questions and providing you with the resources needed to keep you and your family safe. That's why we're here today to talk about the facts, not the falsehoods. I'm joined by 5 panelists who will be helping me answer all of your questions about how we're fighting back against COVID. Today we've got Bob Atlas, President, CEO of the Maryland Hospital Association. Bob, thanks for being here, and say hello.
Thank you, Congressman. Good to be here.
We also have Earl Stoner, my friend, the health officer from Washington County. Welcome, Earl.
Thank you. It's a pleasure to be here this evening.
Matt Helminiak, Labor and Industry Commissioner at the Maryland Department of Labor. Good to have you on, Matt.
Thank you. Good to be here.
Danielle Meister, Senior Policy, Department of Housing and Community Development. Danielle, it's great to talk to you again.
Thank you. I'm so excited to be here.
And finally, Brandon Smith. Brandon's with the Homeowners Assistance Fund. He's the Operations Manager at the Department of Housing, Community Development. Welcome.
Good evening, Congressman Trone. Thank you so much for having me here. I'm very excited to discuss this with you and your constituents.
Excellent. Thank you, everybody, the team, for being here tonight again. Let's dive into some of the questions. Ian, do you have a first question queued up?
We sure do, Congressman. Thanks again for everybody who's joined us on our panel and who's joined us from Maryland's 6th Congressional District. For those of you who joined us a little late, you can submit a question by pressing 0. We're focusing on the effect of COVID and the impacts and stopping the current variant, so 0 for questions and 7 to give us your email address for updates. We're going to go to Michael in Brownsville first. Michael, welcome. You're live with the Congressman in this panel.
Yes. You want me to ask my question again?
Yeah, unless you prefer that I read it. Go ahead.
You can read it, and I can fill in the blanks about.
Will do. All right. So Michael's asking, there seems to be a lot of talk about how bad Omicron is, but it depends on what channel you're watching. But they never mention the differences between Omicron and Delta and which is doing the most harm. Also, with all the people going to the hospital with Omicron, are they going because they're afraid of using extra caution, or is this an actual necessary visit? And that's from Michael there, Congressman Trone.
Mike, that's a great question, really good one. Earl Stoner of Washington County Health. Earl, you want to take a stab at that?
Earl, you got yourself muted there. I'm not hearing you if you're on.
Oh, yeah, sorry, I was on mute.
No worries.
The big difference between Delta and Omicron is really turning out to be really twofold, 2 significant things. Omicron is significantly more transmissible than Delta was, but I guess maybe a silver lining, if you could call it a silver lining, the preponderance of evidence at this point is pointing toward Omicron being a little less on the severity level. So really with Delta, what we were seeing was obviously a pretty highly contagious and transmissible variant that was causing pretty significant illness in individuals, but the vaccines that we have out we're actually holding pretty good against it from a disease severity standpoint, and actually from a standpoint of just individuals becoming symptomatically infected. When we switch to Omicron, which at this point in time is about 95% of the new cases that we're seeing across the country, about 90% in the state of Maryland here, what we're seeing is a variant that has some escape ability from the vaccines and from natural immunity from like a prior infection. But again, we're seeing, at least at this point, preliminarily, we're seeing it a little bit more on the mild end. But I will caveat that with just because it's on the mild end of severity doesn't mean that we're going to necessarily see less hospitalizations and less individuals in the healthcare system. Because when you factor in potentially, a quadruple, maybe even higher number of individuals that are becoming infected, just the sheer number of individuals that are going to need care out of that could possibly equal what we saw with Delta. So, again, two different variants, one with, not as transmissible, but with more severe outcomes, and then new Omicron, which, again, is the predominant, by far, variant that we're seeing now in new cases, highly transmissible. Think of a California wildfire, especially amongst unvaccinated individuals. And once it kicks off, you can just, see on the news now what that causes.
And I'd add that Mike is absolutely right. It does depend on what channel you watch. But I really, the channel that I watch is talking to folks like Earl, but also Meritus Health in Washington County, right there. They've got about 80% of their people that are in now in the hospital are unvaccinated. And the severe cases are just what Earl said, Delta, but they're at the breaking point with the number of cases. And I talked to 7 of my hospitals in the last 4 or 5 days, and virtually all of them are at the breaking point because of admissions, of which 80 to 85% are unvaccinated, unfortunately. Well, that's a great question, Mike. Can we get the next question, Ian?
Sure thing. Our next one's coming from Jonathan in Smithsburg, who's asked me to read it. He says, I've heard that the hospital near me is full, and they want people with non-urgent medical issues to go to the urgent care instead of the ER. What things should I still go to the ER for, even if it's full? And where's the line between non-urgent and urgent? That's a great question from Jonathan in Smithsburg.
That's a good one. That's really good. And the hospital is full there. He's dead on. Bob, can you take a shot at that from the Hospital Association?
I'll give it a try. So conditions that you would have that would suggest you ought to go straight to the ER or call 911 might be severe shortness of breath, chest pain, severe burns or a really serious open wound, a seizure, stroke symptoms, and loss of consciousness, as well as multiple injuries, broken bones of serious nature. Things you'd go to an urgent care for: fever or cold, vomiting, nausea, diarrhea, dehydration, minor strains or muscle strains, or maybe a small bone break, minor cuts, a minor asthma attack, or pain with urination, things like that. The implication of the question is, of course, that our hospitals are very full, and we need people to make the right choice and not overflow our hospitals with care that really doesn't need hospital level attention.
That was good, Bob. Thank you. Thank you very much. Go ahead, Ian.
All right, we've got Danielle in Adamstown next. Says, I lost my job back in September. My job went out of business due to money losses from COVID, and while I was waiting to receive unemployment, I fell behind on my payments. Is the new mortgage assistance program I heard about on the news able to help me? That one's from Danielle.
We got the perfect person. Danielle, Maryland Department of Housing. She's going to have the answer for this one.
If it's okay with you, I actually will pass this off to my colleague, Brandon. He's a lot more familiar with homeowners assistance, but I will happily cover any rental questions.
Okay, Brandon,
I will be absolutely happy to answer that question. So, yes, in that instance, we would be very, very happy to help you in that situation. Maryland, or Department of Housing and Community Development, is very excited that we are able to announce a $248 million fund that is specific for homeowners who are facing some sort of displacement due to some sort of COVID-19 hardship. It's very interesting to point out that in our data review that we do notice in the areas of Western Maryland that have been hardest hit, that there are some instances where individuals will need help with their payments of their mortgage or getting them back on track of being sustainable and affordable. And so, therefore, we've done our due diligence in this program to offer two different types of programs, one being a homeowners assistance fund grant and the other one being what's called a homeowners assistance fund loan. The good thing about the homeowners assistance fund grant is obviously it is going to help with tax delinquency, chattel loans, land lease delinquency. It also can help with homeowners association fees, condo association fee delinquency, mortgage delinquency, and insurance delinquency. And so with the eligibility of those programs, we look for COVID-19 financial hardship after January 21st, 2020. We also ask for certain income requirements to be met as well, where you're under 100% of the area median income, and that it is your actual home. The good thing about the grant program, there is nothing that is recorded, and it's 100% a grant. That maximum assistance is $10,000, meaning that you're not responsible for repaying that back to the state of Maryland. On the other hand, we also offer the Maryland Homeowner Assistance Fund loan, which also is there to provide a one-time payment of delinquent mortgage amount. We like to partner with the servicers, so whatever your servicer is, we will partner with them, where you would go through particular loss mitigation processes with them to see how they can help you as well, but you also have the ability to participate in the Homeowners Assistance Fund loan. That is also eligibility based upon a COVID-19 financial hardship. The difference here is that it is 150% under area median income, and so it is income. We look at the income to be able to approve you for that, and it's also for Maryland homeowners as well. And we ask that you, again, go through different loss mitigation options with your servicer, but we are also going to dual track that by processing your application and get you some sort of preliminary approval. Now, with this program, there is a recorded lien, but again, you are not responsible for any payments for the life of the loan. So, and there is 0% interest on this particular loan. And those payments are deferred to the end of the loan, so you don't have to worry about making payments on that. We are doing this in an effort to be able to reduce what you need to pay month to month in conjunction with the servicers to make sure that you have an affordable, sustainable mortgage. And then for those of you that are further interested in it, you're more than welcome to go to our website, which is homeownerassistance.maryland.gov. Again, that is homeownerassistance.maryland.gov. That'll allow you to do an eligibility check, look at our FAQs, and if you need any further assistance, you're able to call our 1-800 number, which is our call center that helps you with those as well. And that phone number, if you would like to get more information about an application, is 1-833-676-0119. And again, that phone number is 1-833-676-0119. One other thing that we also have in our program is that if you have any problems with filling out those applications yourself, or you needed additional assistance gathering those documents, or just needed to just have someone help you through that, we have also been able to appropriate money to our housing counselors that would be more than happy to help you in that. And so on that webpage actually will give you information to a local housing counselor that you can actually go to. And if you do not see it on the webpage, you're more than welcome to call another call center that we have that will give you information to housing counselors. And that phone number for housing counselors would be 1-877-462-7555. Again, that phone number for housing counselor assistance or legal services is 1-877-462-7555.
That was great, Brandon. Very thorough. Thank you. Ian?
Sure thing. Thank you again. And we've got our next question coming live to us from Andrew in North Potomac. Andrew, you're on. Go ahead, sir.
Hey, Congressman. Thanks for the opportunity. I was just wondering, as a congressman that represents parts of 5 different counties, I was wondering where you stand on schools. And as an educator, we deal with a lot of contact tracing, positive cases, teacher shortage on a daily basis. And I was just curious, where do you stand on what schools should be doing in the current climate with Omicron?
Yeah, no, it's a tough battle for everybody, but I think we'll start off as our teachers. I think they've really worked really, really hard done their best they could possibly do and to get the most out of virtual learning. And we just don't give our teachers, my mom was a teacher, we don't give our teachers enough credit. So that'd be my first thought. But at the end of the day, I've got 4 kids, they're out of school now, but there's no secret, there's no replacement for being in school with other kids. So we've really got to work super hard to get our kids in school. Safety, safety, safety for the teachers, safety for the children. It's especially true in our rural communities and communities of color. Students have disproportionately fallen behind in many places by lack of access to virtual platforms. In Western Maryland, it's almost 40% of the numbers from the heads of the school districts that don't have good high-speed access. It's terrible. You're in North Potomac, so you and I are much closer. And students in our majority black schools, minority schools, are 6 months behind where they would have been in both math and reading. So we got to keep safety and health protocols in mind. But I support getting our kids back in school as much as we possibly can, and helping set up our teachers and give them everything we possibly can. They're grossly underpaid, and so they can, lead the charge because they're the experts. It's a great question. Thank you.
Thank you again. Appreciate you, Congressman. Thank you, Andrew. Thanks for being a part of our forum. We've got Jeannie in Gaithersburg next, who says, I work as a cashier. My job isn't providing us with protective equipment such as plexiglass shields on the register stations and hand sanitizer. Is this something I can report as a workplace safety hazard? That's Jeannie in Gaithersburg.
Good question, Jeannie. How about Matt? Could you take a stab at that one?
Yep, sure. Maryland Occupational Safety and Health is one of my parts of the Department of Labor. So just a real quick difference between OSHA and MOSH. Federal OSHA covers the entire country. There are a couple states, 20 couple states that have state plans. Maryland is one of those. So we have a Maryland OSHA called MOSH. Maryland OSHA covers not just the private sector, but also public sector, state and local government employees in Maryland. If you ever have a question like that of whether or not my employer is providing a safe and healthful workplace, you can either go on the MOSH website, labor.maryland.gov, and click on labor, and it'll show you there, or you can give one of the MOSH offices a call. We have an online complaint form, or you can call in and just call in the complaint. Things like hand sanitizer and plexiglass aren't required under any MOSH statute, so you can always call it in and talk to somebody and see if there's maybe something else that might be required, but those things aren't required under any MOSH statute. Also, just so everybody knows, in case you didn't see the news, the Supreme Court heard the case for the vax or test mandate last Friday, and the decision came out this afternoon. They decided to reimpose the stay. They didn't actually strike down the mandate, but they reimposed the stay and remanded it back to the Sixth Circuit. So as of now, that is not in effect. So hopefully that answered your question. If not, just let me know.
Thanks, Matt. That was great. Ian?
Appreciate you. Let's go to Barbara next. She's going to be live with us from Hagerstown. Just one moment here. Barbara, thank you so much for joining the forum. You're live with the Congressman. Go ahead.
Hi. I wanted to know the status of the antibody treatment, the monoclonal antibody treatment, and when you should get that, if that's available at Meredith, and who should try to get that.
Great question, and something we talked to Meredith, Dr. Joshi, just about the other day. Earl, you want to take a stab at that?
Sure. They are obviously providing those monoclonals. That's a discussion that individuals should have with their primary care or specialist, a physician. But to sort of broadly answer the question, monoclonals, there's actually one now that is being administered as far as sort of an acute. There's also a long-acting monoclonal for individuals who are immunocompromised, moderate to severe immunocompromised, such as individuals who may be in active chemotherapy, organ recipients, those individuals. And Meredith is here in Hagerstown is also administering that. And then you didn't bring up monoclonals, but just from a therapeutic standpoint, the state has limited supplies from the feds at this point of some new antiviral drugs that have come out from Pfizer and from Merck. The Pfizer antiviral seems to be a little bit more effective than the Merck, but nonetheless, our arsenal is being built up as far as therapeutics, in addition to vaccination and, continued layered mitigation strategies. So to answer your question, yes, monoclonals are available. They are available here at Meredith in Washington County, as well as several other hospitals and facilities across the state. I would encourage you to talk to your physician and have them reach out. If you go to covidlink.maryland.gov, there's information on that website. It's a Maryland Department of Health website that has information about each of the therapeutics, including the monoclonals, and it has centers that individuals can contact to inquire about receiving those.
That was great, Earl. And yeah, the antivirals are really in short supply. I talked to my hospitals about that, and if you can, the Pfizer is the one that's, as Earl indicated, much more effective in the high 80s. The Merck, unfortunately, is not as effective. It's in the 30% range, but if you have no choice, I'm all in. And those need to be taken early, right away if you catch it, and they're in pill form. Ian, go ahead.
Appreciate it again. Thank you, everybody. And we're going to take a quick moment here to remind folks that you can press 7 to give us an email address for email updates. We are just about to clear that queue. We had a pretty big backlog. So if you want to get email updates from the Congressman's office, you can do that by pressing 7 on your phone now, giving us your email, and we'll get you updated via email in the future. We're going to go to Beverly in Hagerstown next, who says, I own rental properties and have about a dozen tenants. I am struggling badly because many of them still owe me back rent, and I'm hesitant to evict them because the legal fees cost a lot. Can I apply for rental relief on behalf of my tenants? If so, what do I have to do? Thanks for reaching out with us, Beverly. Congressman?
Danielle, I know you got this one.
Yes, definitely. Yes, so the good news is that all of the Western Maryland counties, as well as Frederick, are currently accepting new applications for rental assistance. And you as a landlord can apply. Your tenant does have to sign the application and provide some household information, and that's a federal rule. So the federal regulations require that the eligibility for the program be based on the household renter information. But you as a landlord can apply on behalf of your tenants, and that's actually a really great option, maybe for tenants who don't have access to a computer or maybe just have trouble navigating an application process. So we definitely encourage landlords to be involved, and you can apply for that assistance. And most of the time, you as a landlord actually can provide most of the documentation that's needed. So usually you're going to be asked for a rental arrears ledger or some kind of overdue rent notice, and typically a copy of the lease. So the majority of the time, it's really, really helpful to have a landlord involved right from the beginning. And if you want to find out how your local application process works, we have a website stood up at the state. It's called rentrelief.maryland.gov. If you go to that website, you'll find a link to every county's application portal, as well as the instructions for how to apply. And particularly in the Western Maryland counties, many of those programs are being operated by social service agencies or other nonprofits, and they're also able to offer your tenants assistance with other things like maybe utility arrears. So they can actually screen for a number of different benefits that folks might be eligible for. But rentrelief.maryland.gov is the right place to start, and just click through to your local county application, and hopefully we can get you squared away.
All righty. Thank you so much. Appreciate that answer as well. And folks, we're going to take a brief moment to get our next question queued up. This will be Michael in Poolesville, but I wanted to let everybody know we're going to run a poll question in a moment here. We'll ask for your opinion. You can vote using your phone. So stay tuned for that. And I'll go through a quick refresher of all of our guest speakers who are on the line with us today as well. So hang tight. Let's get Michael's question answered first. Michael in Poolesville, thanks for being on. You're live.
Hey, thanks, Congressman. So I run a small business, and I know when COVID hit the first time, there were grants that came out to assist. We were able to make it through that time, but currently now with supply chains being messed up and taking a while to get products and materials, is there anything in the future that the state's looking at for either grants, well, preferably grants to help out with the small businesses again?
Yeah, no, Michael, I appreciate that. And as a businessman, my entire career, 30-some years until now, I've always worked for myself, as you probably know. We really needed to step up for business. And as you said, they needed to be grants, not loans. And they were grants in the large part. I'm on the Appropriations Committee now, which is the right place to be. And I think I'm a strong voice for business. But right now, there's nothing directly in the queue that's left from what was there before. But we're going to need to address in a bipartisan way this supply chain. My company's been affected by it very adversely. I mean, everybody's being affected by it. There's tremendous shortages. I can't tell you how many have hit my company. It's just craziness. And sounds like you're getting hit the same way. So we need to look at that in the future as we go forward. But we're going to need to work on supply chain and work on, as part of this bipartisan infrastructure bill. There's going to be some things in there that can help on supply chain, and that hasn't rolled out fully yet to the states. But I would reach out to my office, 301-926-0300. The number's up on the screen there. And they can keep in contact with you as we see ideas that could be helpful specifically to your business, because so many are being hurt by this really train wreck of supply chain. But I do think it's getting better. We're seeing improvements, but it's still not good. So thanks again for that one, and there's nothing more fun than working for yourself.
Appreciate you, Congressman. Thank you. Thanks for that last question. We're going to go to Brandon in Brunswick up here next. Brandon, thanks for joining us here with the Congressman. Go ahead.
Hi, thanks for taking my call, and thank you, Congressman, and the panel for joining. So I kind of have two questions. The first is, when it comes to the capacity of the hospitals, is there a way for us to understand what is the capacity hospitalized because of COVID versus the capacity hospitalized and happen to have COVID as a secondary symptom that has required additional PPE, but is adding to the number of overall hospitalized patients with COVID? The second half of that is, what are federal, state, and local officials doing to bolster the capacity for our emergency medicine capabilities in this region? I moved to this region about 5 or 6 years ago from another region that had a lot of competing health systems, and I come here to the capital region, and it just seems like we're really stretched thin with our emergency medical capabilities. What can be done about both of those situations, getting the numbers and expanding our healthcare capabilities?
That's a big question, a complicated question. And I was just in Brunswick last week with Mayor Brown looking at the water situation and trying to get some ideas to help him on that and infrastructure. Let's send this question over to Bob. He's the right guy at the Hospital Association.
Thank you, Congressman, and thank you for the question. I may need you to restate parts of it, but in terms of this issue of people sort of being at the hospital either for COVID or with COVID, I've been just today talking to leaders of some of our most esteemed medical institutions in the state, not just those in the region, in the Congressman's district, and the way they look at it is it doesn't really make a difference. The care that people need is basically the same intensity, requires the same resources, and we haven't really been able to differentiate. Within the Within the acute care hospitals in the Congressman's district, just to let you know, latest statistics indicate that there are, we've got 117 ICU beds total staffed in the district, and only 7 of those beds are unused right now. And of the 110 that are used, it's actually 50% COVID and 50% there for other reasons. The acute care beds are slightly more plentiful, about 10%, but and those patients are about 40% COVID and 60% non-COVID. So there's not a lot of difference in the way that they're treated. As far as PPE, hospitals certainly have enough, and at this point, thankfully, and are deeply invested in infection control, so that everybody, regardless, is protected. I think your second question was about emergency services capability. Don't know where it came from before, but in Maryland we have some regulation of hospitals. One is called Certificate of Need, that where we have a state commission that decides where we need new healthcare capacity. So, for instance, recently in this district, we had the creation of the Holy Cross Hospital in Germantown. That's fairly new. And we had the opening of the Adventist freestanding emergency care center. So actually, emergency care capacity in this district has actually grown, which of course makes sense because our population is growing pretty significantly. There's always a bit of a pull and tug here because of, nobody wants to spend more than necessary on health care, and so it's in everybody's interest not for us to overbuild.
That was good. Thank you, Ian. Ian?
Appreciate it. Let's thank you, Brandon and Brunswick. Appreciate you and your question. Thanks for your participation. Folks, we're going to take a quick break here. We are 35 minutes into our 1-hour forum. We got 25 minutes left. I'm going to run a quick poll question. We'd love your feedback on this. I'd also like to remind you of who our guest speakers are. Of course, we have your Congressman, David Trone, representing you in Maryland's 6th Congressional District. We have Bob Atlas, the President and CEO at Maryland Hospital Association, Earl Stoner, the Health Officer for Washington County, Matt Helminiak, Labor and Industry Commissioner at the Maryland Department of Labor, and Danielle Meister, who's the Senior Policy Officer at the Department of Housing and Community Development. Finally, we have Brandon Smith, who's the Homeowners Assistance Fund Operations Manager at the Department of Housing and Community Development. And you've heard from all of them answering your questions today, so thanks again to them, and thanks to you for all these questions. Our question for you is, how prepared do you think your communities are to fight the Omicron variant? Press 1 if you feel your community is very prepared. Press 2 if you think it's somewhat prepared. Press 3 if you think you're not very prepared, and 4 if you're not prepared at all, and 5 if you're not sure. So again, our question for you is, how prepared do you think your community is to fight the Omicron variant? Press 1 for very prepared. Press 2 for somewhat prepared. 3 for not very prepared. 4 for not prepared at all, and 5 for not sure. Go ahead and let us know now, and again, we very much appreciate your feedback. For those of you waiting to give us an email address for email updates, there's 27 of you left in line. I bet we'll have everybody's emails collected in the next 10 minutes. So hang tight. We'll have an operator with you shortly. We're going to go to our next live question from Lori in Rockville. Lori, you are live. Go ahead, please.
Hi. Just wanted to thank everybody, especially Congressman Trone, for doing such a wonderful job and keeping us all up to date on things. It helps relieve a little bit of the anxiety. I just wanted to know, because it's been mentioned, mainly with Dr. Fauci saying to use whatever the most comfortable upgraded version of mask. And my husband and I, we have some underlying conditions, but nothing grave, like an immunocompromised condition, like a dear cousin of ours who just recently passed from COVID. But what is your feeling about majority of us getting N95 masks.
Lori, first, I'm sorry for your loss, and let's let Earl take a look at this. I have a KN95 that I wear all the time. Earl?
So, yeah, that's a really, really good question, and I think that before I answer that, I think that probably over the course of the next 3 to 4 days, it's my understanding that the CDC could very well come out with a recommendation for everyone to upgrade their mask in line with the question that you've asked. But yes, I would definitely recommend an N95 or a KN95, and then there's also a KF94. Basically, the N95 is obviously a respirator, 95% filtration. It's NIOSH approved, basically, which is an American standard. The KN95 and KF94 are basically KN95 is the Chinese version of an N95, and the KF94 is a South Korean version of N95. So all of them have 95% filtration. Personally, throughout most of the pandemic, I have worn a KN95. It's just a personal preference of mine. Your best bet is to go with a N95, KN95, or a KF94. Honestly, any of those are going to give you pretty good protection. I will say that before you buy any of those, I would go to the FDA.gov or CDC.gov website, and on those websites they have approved lists and then counterfeit lists. And in particular, with the KN95s and the KF94s, there's, unfortunately, like we see in a lot of sectors, a pretty good market going on with counterfeit masks. So definitely upgrade your mask. Cloth masks at this point are better than nothing, but really people should not be wearing cloth masks at this time. I would go with one of these three or even a surgical mask. So that's a really, really good question, and I think you'll see the CDC come out with a recommendation to upgrade your mask here in the near future.
Yeah, I think that Earl's dead on. We were just speaking this morning. We had a call with the head of the CDC, the director, Rochelle, who coincidentally is from Potomac and went to Winston Churchill High School, believe it or not. It's a small world. But the KN95 is really, I think, where we need to be sure we're there at least, but that's more comfortable mask than the N95, which might be a little bit stronger, but not much difference. But it is a little uncomfortable, whereas the KN is much more livable, and that's what I wear, and sounds like Earl does also. Thank you. Ian?
Excellent. Thank you again, everybody. Let's go to Billy in Clarksburg, who's asked me to read this one. Billy says, I saw on the Mortgage Help website there were two different programs, a grant and a loan. Can I get both the grant and the loan at the same time, or do I have to choose just one to apply for? That's Billy in Clarksburg.
Brandon, could you take a shot at Billy's question?
Absolutely. So individuals are able to take part in both the grant and the loan. Again, the grant maximum amount is $10,000. The loan is a maximum of $30,000. You don't have to choose between the two, but you can get both of them for a maximum contribution of $40,000. The important thing to note that there's two different types of area medium income that is considered. For the loan, you have to have below 150% of the area media income. For the grant, you would need to have below 100% of the area media income. So in order to be qualified for both of them, essentially you would need to have below 100% of the area medium income, which is, of course, different from area to area. But we will soon have a chart, if it's not on there, exactly showing what the area median income is for each area. So the question so the answer is you could potentially qualify for both the grant and the loan and not have to decide between the two. But do remember that the grant is something that you do not have to have recorded against your property, and it is exactly what it is, a grant, something that does not need to be repaid. The loan would need to be repaid, and it would be subject against being deeded against your property. But again, it's 0% interest, no payments until the end of the loan.
Okay, that was great. Thank you for that. Ian?
Sure thing. Let's go to, we've got Deanna up next. Deanna in Montgomery Village, who asked, my workplace just closed for at least a week because a lot of the staff tested positive for COVID. Am I able to file for unemployment benefits for the week or weeks my workplace will be closed and I don't have any money coming in? That's Deanna in Montgomery Village.
Good question. We've had so many challenging questions on unemployment that we've worked with our constituents. Matt, you want to handle this one?
Sure. There's an answer that we get similar questions like that all the time. Basically, if you're unemployed or not able to work and you want to file, you go on the website, you file the claim, and be truthful in all your answers and let unemployment make that decision. There's no penalty for filing if they turn you down. It doesn't get held against you. Just go on there, let them make a decision, but be truthful in your answers. So I wouldn't be able to give you an answer of whether or not you would qualify. Each of those are fact specific, but it doesn't hurt to file and let them make the choice.
That's good, Matt. Thank you.
Appreciate you again. Let's go to Lynn in Adamstown next, who says she came down with Omicron on 1/29 and took a home test, which was positive. Her symptoms were mild, like a common cold, runny nose, and headache. She was vaccinated but not boosted. She self-isolated for 5 days and then tested positive again. At what point does she get a third test? She has no symptoms but does not want to be contagious. How long should we wait now? And that's from Lynn in Adamstown. Let me know if you need me to repeat any of those details from her.
Lynn, that's a great question. My son is sick right now with his second bout with COVID, and he's got some of the same questions right there. So, Earl, can you answer that for all of us?
Sure. I would. Can you read that again, the timeline?
Sure thing. So she came down with Omicron on, looks like the 29th, and took a home test, which was positive. Her symptoms were mild, like a cold, runny nose, headache. She was vaccinated but not boosted. She self-isolated for 5 days and then tested positive again. At what point does she get a third test? She has no symptoms now but doesn't want to be contagious.
I would say that you probably should talk to your physician, but individuals typically, and we don't necessarily know with Omicron yet, but if it holds through with the typical shedding that we've seen, typically within 8 days, individuals have shed enough of the virus to not be infectious any longer. There are some individuals that, mostly immunocompromised individuals, that will be that are immunosuppressed, that will continue to be infectious. But typically, you aren't infectious. But you can honestly, some people can go on for weeks and still be, quote unquote, symptomatic but improving. Still test positive, but also not be infectious. So again, that would be a more sort of complex technical question for your personal physician. But again, most likely you aren't infectious any longer. But again, you could still, and some people do still test positive for weeks, and it's rare, but there have been individuals that have gone on months and still tested positive.
Wow, wouldn't have guessed that. Ian?
Appreciate it again. Thanks for the answer. Thanks for that question. We're going to go to Michael next, who's in Gaithersburg and says, I'm trying to get the rental assistance, but my landlord is refusing to sign off on the form. Is there some way that I can get the rental relief money without my landlord signing off on that form? That's from Michael in Gaithersburg.
Great question. We've heard that one. Danielle, can you knock it out?
Sure, yeah. So this is a question, I think, for your local county program that's administering your application. So I think I heard it was Gaithersburg. Is that right?
That's right.
Okay, so you would definitely want to talk with the Montgomery County program, since they're the ones that make the payment themselves. But generally, most of the counties across the state have started the process where if a landlord refuses to participate in the program, they can make a payment directly to the tenant. So not all counties are able to do that, but most are. So Montgomery County would really be the right entity to answer that. Sometimes it's not so much an issue of the landlord is unwilling to accept payment. It might be that they're unwilling to provide documentation. So depending on each individual's circumstances, it might be a little bit different, which is why I encourage you to reach out to them. But generally, most counties across the state have been able to make payments to tenants directly if their landlord is refusing to accept a payment.
And Mike, feel free to reach out to my office right there in Gaithersburg, and we can help you with that also. Just reach right out. Thank you.
Appreciate you. Thanks again. And folks, if we didn't get your question answered in the next 10 minutes here, we got really about 12 minutes left in our forum. Remember that when we get to the end of the forum, if you still have questions, you still need assistance from Congressman Trone's office, you can stay on the line, leave a voicemail message, and they'll be able to give you a call back over the next few days and answer your questions directly. I'll also give out the website and the district office phone number one more time before we get to the end. Let's get a few more questions before we get to the end, though. We've got Angeli in Potomac up next. Angeli, thanks so much for waiting. You're live. Angeli, you still there with us? All right, let me read their question. It says, I'd like to know if there are any updates on the at-home testing kits that are available. I'm a physician, and a lot of people have been complaining that they can't get tested or that there is a long line while they're trying to get tested. And that's from Angeli. Sounds like she's a physician. She works in Potomac.
Yeah, good one. A lot of people are going to be asking that question. Earl, you know the status?
Yeah, they unfortunately, with the surge that we're seeing, in these at-home antigen test kits are hot commodities these days. I would again point you in the direction of covidlink.maryland.gov. There are links on that site that will take you to county level distribution. I can just speak for most of us are partnering, and when I say us, most counties are partnering with local libraries. And libraries are then distributing through, obviously, their main branch and their other smaller branches. Again, I would go to covidlink.maryland.gov to find out, how that distribution is going and get down to your local level. But again, they're hot commodity these days, and, there are limited supplies that we receive as health departments from the state health department.
And I'd add to that. Go ahead.
Go ahead.
I would just say Earl's dead on with that. The president also has just purchased another 500 million cases, and they're going to put up a website, which we'll have on our website next week, where you can go to order those through the U.S. Postal Service. Go ahead.
All right, appreciate it, Congressman. I was just can I ask you to confirm that website you read? Is it covidlink.maryland.gov?
Correct.
Perfect. All right, thank you again. I appreciate the answer one more time there, and let's get our next one up. This one's going to come to us. Sorry, one second. This one's going to come to us from Rebecca in Rockville. Hey, Rebecca, thanks. Go ahead.
Yes, my only question was working in the health industry right now as a health worker in long-term facilities and nursing home. I just wanted to know, seeing the growing number of cases, especially with such a frail population of elderly care, is the congressman or the governor, anybody thinking about like a short period of shutdown for visitation and stuff to prevent the outspread more any further?
Well, first of all, Rebecca, I want to thank you for being on the front lines, and it's one tough job that just never seems to end. And now we realize it's never will be ending permanently. We're going to have to live with this and work with this, and we've got to learn how to live and educate and exist side by side with the wonderful vaccines we have, thank goodness. Bob, you want to take a stab at that?
Sure. Just to let you know, I don't represent the nursing homes, but the hospitals. But I will say Governor Hogan just today did issue some new orders pertaining to nursing homes to reduce spread of infection among both residents and patients and as well as staff of the facilities. And, we on the hospital side are taking great care not to send patients back to nursing homes who might spread infections, which of course is challenging for our hospitals because we need to free up beds. There's awareness and an interest in making sure that our nursing homes and the people who work there are well protected.
That was good. Thank you, Bob. Ian?
Appreciate you again. Thanks. Let's take a quick moment. So we've got a few of your questions we've tagged for follow-up, folks. They're just a little bit too personal or dynamic for us to answer in this live forum. So I just wanted to give a quick shout-out to a few of you who we have tagged to follow up. You don't need to leave any messages at the end of the forum. We're just going to have the Congressman's office reach back out to you. So Lynn in Hagerstown, Charlene in Frederick, Cindy in Cumberland, Atara in Poolesville, Abdul in Columbia, Veronica in Germantown, Sonia in Gaithersburg, Virginia in Hagerstown, and Myrna in Hagerstown. We're going to reach out to all of you. You don't need to leave a message. We've got your question and your phone number. Let's go to this next question from Dustin in Frederick, who says, I'm losing my job next week. I know that it's going to be a while before I find another job. I'm worried about paying my rent in the meantime. Can I apply for rental assistance now, or do I have to wait until I actually fall behind on my rent payments? That's from Dustin in Frederick.
Smart, Dustin, getting out ahead of it. That's good. Danielle, can you knock that one out?
Yeah, generally most counties are providing both prospective rental assistance for up to 3 months at a time, in addition to helping out with rental arrears or rent debt. So Frederick County's application system should be available. They are accepting new folks, and it's a great idea to get ahead of the curve. It can take some time to process applications, so by the time you submit it and they do your review, you may be ready to get that assistance for your next rental payment, or may have already started to accumulate arrears. So it's great you're acting now. That's exactly what we want folks to do. But you can go to their application website and see what all of the regulations are for Frederick. But in general, you are able to get prospective rent for up to 3 months at a time. What you'll be required to do is come back in another 3 months if you need more assistance, and provide new updated income information and tell a little bit of information about your housing status and whether it's still unstable. So you can get total, and this is true for everyone, you can get a total of 18 months under the program for assistance, and that prospective rent is 3 months at a time. So you can potentially come back multiple times if, unfortunately, this were to be prolonged of a situation for you.
Ian?
Thank you again. All right, I think we've got time for another one here, so I'll remind everybody when we get to the end, you can leave a voicemail message if you have any additional questions or concerns and need assistance from the Congressman's office. You can stay on at the end, and by staying on, you go to the voicemail system, you can leave a message there. Let's get Claudia in Williamsport up next. She says, I recently saw a thing online that said for Omicron, the tests are more accurate if you swab the back of your throat instead of your nasal passages. When I am using one of my at-home tests, should I be swabbing my throat instead of my nose, like the instructions say to do? That's from Claudia in Williamsport.
Claudia, my people tell me that's coming from TikTok. Not that I know what that means much. Earl, you want to give us an answer on that one?
I would say no. You should use the test just as the instructions instruct you to do. There's some tentative, and I'll say preliminary research out there about swabbing your throat. There are some really, really small studies, one or two that found or that claim to have found that it was more effective at picking up Omicron. But the CDC and the FDA and the makers of the test are instructing everyone to use the test as the instructions lay out. So do not, at this point in time, do not swab your throat in addition to your nose.
Thanks, Earl, for that. That was great. Ian?
All right, and Congressman, unfortunately, we've just got a few moments left, and I'd love it if you could share any closing thoughts before we get to the end here. But I just wanted to repeat a little bit of information we stated at the beginning in case anybody needs any assistance. The district office phone number is 301 301-926-0300, or you can go online to trone.house.gov and get information there. If you didn't get a chance to sign up for email updates from the Congressman's office, you can do that at that website. That's trone.house.gov, and that district office, again, 301-926-0300. And Congressman, I'll turn it back over to you to take us to the close here. And folks, again, stay on the line and leave a message if you need more assistance.
Yeah, great. Ian, thank you, and I want to thank our panelists tonight. Yeah, you all did a great job. We had a lot of wonderful questions. We've got some more questions still on the line, and ones we mentioned we're going to call back automatically. The other questions that are still out there, we're going to reach out in the next couple of days on every one of those questions directly to you and get you a response. I mean, I work for you, we all work for you, and we're in this together as Team Maryland to get through this COVID tragedy that's hit our country. Please sign up for our newsletter. We have all kinds of good information about how to stay healthy in it at trone.house.gov and ongoing COVID-19 updates. And again, at our office, call us. We're here for you. Please, 301-926-0300. Thanks for being on. Good night. Take care. And most importantly, you and your families stay safe. That's what matters. Thanks very much.